found to be really key. Having somebody else that you can talk to, confide in, communicate with throughout the process that's going to be supportive. That has been shown in studies and things to be significant and benefit. Florida actually does have a phone line that you can call. It's called Tobacco Free Florida, and if anybody wants that phone number, I can give it to you. But they offer free support. They offer free tools and things you can use, like the patches and the gum and stuff. They can all get that to you for no charge. They also provide counseling and conversations and things like that. So let's focus now on nutrition and exercise, because these are two of the biggest things that throughout our lives we're all thinking about what we're eating. Are we eating healthy? Are we exercising enough? Or we all seem to have an appreciation for that and understanding. And by far, these are the two biggest things that you can personally impact and make a difference. And I'm going to make the argument that they are the two most significant things that you can do. So first, let's talk about just some parameters, some things that you can use to determine kind of where you're at in your overall health as far as physical fitness. So waist circumference is a measure that's used. So a high waist circumference and too much abdominal fat. So specifically fat carried in the abdomen. Some people carry their weight more in the legs, but specifically abdominal fat puts you at increased risk for type 2 diabetes, high blood pressure, high cholesterol, and heart disease. So for men, your waist should be less than 40 inches. For women, that number is 35 inches. So how do you measure waist circumference properly? So you want to use a tape measure, and you don't want to have a shirt on or anything, just a bare abdomen. And you're going to rest the tape measure just across the top of your hip bone. You'll pull the tape measure until it's snug. You want to exhale and relax, and then look at the measurement there. So it's right across the top of the hip bone. It's not way down on the waistline. It's actually up a little higher than that. And again, 40 inches or less for men and 35 for women. Anything over that and you're considered to be at risk for those disease states that we just mentioned. So another thing that gets talked about or used a lot is body mass index, BMI. So what is that? Body mass index is used to help screen to identify weight problems in adults. So specifically, a lot of times the doctor's office will do this calculation. There's little calculators on the internet that you can use to do it yourself. But it's using your height and your weight to help determine if you are overweight or if you're underweight or if you're healthy. It's not a diagnostic tool. It's only just something that we use in conjunction with other things to help determine your overall health. So if you use one of those calculators, underweight is going to be anything 18.5 or lower. Normal weight is 18.5 to 24.9. And you begin to be overweight if you get a BMI number of 25 or above. And then over 30 is when they classify you as obese. So let's talk a little bit about physical activity. So the American Heart Association has given us some specific recommendations for physical activity in adults. And so the number is 150 minutes of moderate intensity exercise per week. And they recommend that be divvied up into 30-minute increments, so at least 5 days a week. So you perform a moderate intensity exercise, and we'll talk about what some of those things are, for 30 minutes, 5 days out of the week, and you're going to hit that 150-minute goal. If you're somebody that likes to be more active than that, then the other option would be a vigorous or high-intensity exercise, and they recommend 75 minutes a week of that. So that would be 25 minutes, 3 days out of the week. So what are some moderate intensity exercises? Brisk walking, water aerobics, doing any type of dancing, gardening, tennis, and like slow cycling, biking at less than 10 miles per hour are all considered to be moderate intensity exercises. So doing one of those types of activities, 30 minutes, 5 days a week, you would be hitting your exercise goal that helps These numbers out of studies, they came up with this number, this recommendation, based on the amount of activity that seems to help reduce the impact of heart disease. So doing this much exercise on a weekly basis helps reduce your risk for heart disease. Make that clear. So vigorous or high-intensity exercise, some examples of that would be hiking up hills, backpacking, so hiking with a backpack, running, swimming laps. Heavy yard work could actually be considered high intensity. So doing like digging or hoeing in a garden or something for a half hour. Cycling, so riding a bike at faster speeds, 10 miles an hour or above, and jumping rope is considered to be a high intensity exercise. So let's talk a little bit more about nutrition. So I feel and am convinced that this is the most significant thing that you can do. And I'll tell you a little bit personally for me, because I mentioned at the beginning of this that my family has an increased risk for heart disease. So I've always assumed that I'm genetically predisposed to having heart disease. So what are the things that I could do to help reduce that risk? And I talked about my grandmother having a heart transplant. My grandfather died of strokes. My mother has had heart attacks, right? Multiple stents placed. So and so my own personal, so if I go back like four years ago, I was at a point where I was coming close to needing to be put on high blood pressure medication. I was regularly checking my blood pressure at home, and I was getting numbers in the 140s, over 90. I'm like, man, I really should probably think about getting into the doctor and look at this, because I don't want to go down that path of having heart attacks and strokes young in my life. And then I came across some information. Maybe you guys, has anybody heard of Forks Over Knives or Game Changers or any of those documentaries? Yeah. So I came across some of that information, and I started digging deep into that and really looking into that. And I changed my diet and the way that I eat. And I saw my blood pressure drop to like 118 over, 60 something. So it was dramatic. And I was like, this is very impactful. This has made a big difference. And I lost about 20 pounds. And I wasn't doing any calorie restriction. It was the opposite of anything I learned in school about how diets work. When mostly it's about calorie restriction, less intake, more output. And if you create a calorie deficit, you'll lose weight. And that wasn't what I experienced. And so I went to my parents, my mother, who's had this history of heart disease, and I started talking to her, and she was on 3 blood pressure medications, a statin, a couple of other things to help treat chest pain, angina pain. And she took it seriously, and she began eating differently as well, and she lost like 30 pounds. And she was able to come off all but one of her blood pressure medications, came off all the medications for chest pain. So there's data and there's information in studies, and I'll talk a little bit about that. But I also have this personal experience that I've walked through, and want to encourage you guys that it takes very little risk, right? We're just talking about changing what you eat, and try it out for a month and see if it makes a difference. So let's talk a little bit about that. So I'm going to talk specifically, there's a program, there's a doctor that created a program. His name is Dr. Dean Ornish. And he created a program that's actually Medicare approved. So if you meet certain criteria, Medicare will actually pay and cover for you to go through his program. And they have locations across the country. I believe there's one in Jacksonville. And it's actually considered, he calls it the Ornish Reversal Program. And they have studies that have shown that they can help you reverse heart disease, reverse diabetes, and lose weight. That's stuff that commonly in the medical field is just not talked about, the possibility of reversing.
What was the name again?
Dean Ornish.
Dean Ornish.
Yeah, O-R-N-I-S-H.
Oh, good, thank you.
Yeah. So I have some pictures up here. It's really unfortunate we couldn't get the presentation up. I think she's trying to print copies for you guys, so hopefully you guys will be able to get a copy. But these are actually pictures, angiography, of showing people that in some of these studies that had blocked arteries in their hearts, and after, I think a lot of them are 32 months, 60 months, but they showed increased vascularization to the heart. That doesn't happen. That's not something that, normally in the medical community, the go-to here would be we just go in and do a stent, and we open it back up. But this, just through diet, they were able to revascularize and create more, less hardness in the arteries and more, reverse some of that hardness and stenosis. So what does this diet look like? Well, it's high in good carbs, good fats, good proteins, and it's low in the bad version of those things. And we're going to talk about what the good and the bad versions are. So the emphasis is on eating real foods that are found in nature and staying away from anything processed. And then there's a few more specifics inside of that. But that's the biggest piece. If you take away anything, it's get rid of all the processed foods. Our American diets are so loaded. I mean, you can't go out to eat hardly without eating processed foods. You go to the grocery store and all that prepackaged stuff, it's really unfortunate because it's very convenient, right? And so that's where we fall into this trap just because it's so convenient. But all these processed foods, so specifically, if you go to the World Cancer Society and you look at, they classify like what are class 1 carcinogens. So tobacco that we just talked about is class 1 carcinogen. Well, so is hot dogs and deli meat. They've been shown in studies to be just as cancer causing as tobacco smoking, which is wild to me. It's crazy, but they have the studies to show it, and it's on the World Cancer Society website. It just doesn't get talked about a lot. So this is going to be more, and this is, over the last couple of years, this has been more commonly talked about, but it's going to be classified as a whole food, primarily plant-based diet, okay? And it's not an offer-on thing, so if you take any steps in this direction, you will see some benefit, because the big thing, if you're trying to reverse heart disease, the big thing that like Dr. Ornish's program is going to do is he's going to have you cut out just about all meat. And for some people, that's really hard to do because a lot of us are big meat eaters. And what I will say is don't let that be well, I'm not even going to try any of this because I can't let go of meat right now. Make it, yes?
Are we talking about just red meat or?
So the red meat is the absolute worst, okay? Chicken and turkey would be lesser, but still he cuts all that out. The only thing in Dr. Ornish's program is he does occasionally allow for a piece of fish. And yeah, I'm talking specifically about his...
It's a vegan diet?
It's more of a vegan diet, but vegan diet doesn't really quite explain it because there's a lot of people that are vegan for like animal rights reasons, and so they don't care that they're eating a lot of processed foods. So there's a lot of vegan foods that are... Oreo cookies are vegan, but you can't eat Oreo cookies. That's not healthy. So, yeah.
You were talking about the effect the arteries, the hardening of the arteries.
Yeah.
What about the veins? Does it reduce the hardening of the veins?
Yeah, so the difference between veins and arteries is that arteries are carrying blood supply and veins are returning it. So it's going to impact both, but when we talk about heart attacks and strokes, those are we're primarily talking about arteries, because if you what you're doing if you block an artery is you're preventing the blood from getting to it, and so specifically a heart attack is a blockage in an artery that supplies blood to the heart muscle, and so if you begin to lose blood supply to the heart muscle, that's a big problem, and so that's what a heart attack is. We don't really talk about that so much when it comes to veins. So there is terminology for that, like peripheral vascular disease and stuff like that, where people have a lot of pain in their legs, and their legs swell, and it's because the blood isn't able to return to the heart very well. So peripheral vascular disease would be more in the veins than it would be in the arteries. So yes, it's going to impact both. There's no there's no functional difference or makeup difference between a vein and an artery other than what they're doing. And we just call one arteries because they're supplying and one veins because they're returning blood to the heart. Does that make sense? But as far as like a dietary change that might help reduce blockages, it's going to do so in veins and arteries. Is that okay? Does that answer your question? Yeah. Okay. So we're talking about eating mostly plant-based foods and mostly in their natural form. So we're talking about a high intake of fruits, vegetables, whole grains, legumes. We're talking about eliminating or severely reducing any type of intake of refined carbohydrates, refined sugars, concentrated sweeteners, white flour, white wheat, and white rice, because those are all processed in a way that causes them to be, your body just sees them as like a high carbohydrate, and they get into your bloodstream really quickly. And so what about fat and proteins? So fats you're going to get primarily from nuts, seeds, and a little bit of it with his diet. I'm talking specifically about his diet because it is Medicare approved. So it does have that additional kind of backing behind it. He does allow some fish occasionally, so there's some fish oil that would be providing good fat as well. And he allows egg whites, so some other protein sources besides egg whites. Egg whites are really high in protein, but other protein sources would be tofu, tempeh, beans, legumes, and then non-fat yogurt and non-fat cheese. So if you guys are interested in knowing more about that stuff, I can point you guys towards some documentaries if you're more of somebody who likes to view things, or I can point you to some books that are also very helpful. The big one of the big ones, there was a book called The China Study. And there's also a documentary about that. And that's just really interesting. And there's another book called Reversing Heart Disease. That one's by Dr. Ornish. And another book called Prevent and Reverse Heart Disease by Dr. Esselstyn. And he was part of the Cleveland Clinic, which is a very prestigious place. Documentaries, there's Forks Over Knives, which is pretty well known. Game Changers, pretty popular. There's a China Study documentary, and then there's Plant Pure Nation. But we can... So what you guys have to do is you have to look at those risk factors: high blood pressure, high cholesterol, high blood sugar, diet, exercise, tobacco use. And you have to say, what is the glaring thing that stands out to me personally that is increasing my risk of heart disease, and what do I want to focus on? And then that's where you start to have a conversation with your doctor or your pharmacist about what that is that you're willing to tackle. And then you can create a plan to help reach your goal when it comes to reducing your risk for heart disease. I would recommend not, like, maybe you look at those things and you go, man, there's 3 or 4 things there that I'm really need some work on. Don't try to take on all those things at once. Just focus on one risk factor, be consistent, and tackle that. And then after that, move on to another risk factor. Sometimes we, get a bunch of enthusiasm and we run out the gate trying to do a bunch of stuff, and then we fall short just because we lose track of where we're at and get overwhelmed. So how do we reach our goals? So just, like I said, any type of move in a direction of increasing whole food in the plant-based arena, so fruits, vegetables in their whole food form, so right out of the produce section, and increasing whole wheats, whole grains, so brown rice, barley, all that stuff, farro. And any increase in that stuff has been shown to reduce risk of heart disease, reduce risk of diabetes, reduce risk of cancer. There's a really strong correlation between high fiber, eating whole wheats and whole grains, and reduced risk of cancer. That's like a big thing. And then, don't forget, like, include your doctor and your pharmacist, get people on your team, people that are going to help support you in that and walking down that path. And, utilize them, like have conversations. So what questions do you guys have? You can talk.
You had mentioned about the herbal remedies.
Yeah.
I know there's a big push these days for the CBD
Yeah.
and whatnot.
Yeah.
What's your take on that?
As far as heart disease?
No, just in general.
Okay. Yeah, so we're still kind of waiting on some higher levels. Yeah.
The lights dim so you can see that better?
No. They don't need to see that. um, so we're still waiting on some like good quality studies to come out as far as CBD oil specifically. The reason for that is it's still kind of an inhibiting factor. On a federal level, you know, it's been marijuana and all its derivatives were considered Schedule I substances. So universities who are primarily the ones doing studies on that stuff weren't able to gain access to it without special approval and all this stuff. So there wasn't a whole lot of move to study it. And so we're still, I mean, that's becoming more of a thing. We have seen some initial studies that show it is a good anti-inflammatory, and it does help reduce pain. So there is some support for that for like arthritis. There's a lot of anecdotal evidence as far as calming effects and helping with insomnia and sleep. So those are the primary things that I see people purchasing CBD to help with, and like calming, anxiety, insomnia, and then pain-related uses.
But I mean, I know, I guess everybody else should know, you don't get high from that stuff.
No, not CBD. No. THC is the substance inside of marijuana that is hallucinogenic.
People don't want to try it because they're afraid.
Oh yeah, yeah, no. CBD products, if they're made properly, which the state of Florida has regulations about the use of CBD products now. And what you should look for when you go to the store, if you're looking at a CBD product, look for a little QR code. Is everybody familiar with what a QR code is? It's like a little square barcode. And your phones, if you have a smartphone, you should be able to scan that. And that's legally required in the state of Florida to be on the packaging for a CBD product. You should be able to scan it, and that'll bring you to a certificate of analysis that was performed by an independent lab that shows that this product contains what it says it has in it. And that's something the state of Florida came out as a regulatory thing. So if you don't see that on there, then it might be kind of one of these rogue products that's, yeah. Yes?
I've heard that vitamin K2 along with D3 combined can help your cholesterol level. Have you heard anything about that?
K2 and D3. So here's what I'll say about that. I don't have as much information off the top of my head about K2, but D3 is something that as a society in the United States, we are almost all deficient in D3. And so they actually have specific recommendations for anybody aged, I believe, 50 and over to get a certain amount of calcium and vitamin D3. And the reason for that is just that those two things work together. So D3 helps with the absorption of calcium, but specifically that we're chronically low as a society. So vast majority of people, we could test your D level and you would come up deficient. And it's the only vitamin that has been shown in studies to impact what's called all-cause mortality. So having low vitamin D levels, they don't know why, but when they do studies, seems to correlate to more deaths. So I always recommend people take a D3 supplement. Just it's cheap. But yeah, you do get vitamin D in the sun, but for whatever reason we don't, because sunscreens and stuff are so common because of risk of skin cancer and whatnot. But yeah. Yes.
What about melatonin to sleep?
Mm-hmm.
Is that a cure-all for insomnia?
Cure-all, no. Does it help many, many people? Yes. And so melatonin is a natural hormone that your body creates that helps regulate the sleep-wake cycle. So the best way to use melatonin is to take it shortly before you go to bed, okay? And you want to lay down in a dark room and close your eyes. Because it's not something, it's just a natural hormone. And by boosting the level a little bit when you go to bed, you'll help yourself fall asleep. But it's not something that's going to like, oh, I take a melatonin and it knocks me out. It's something you have to use in conjunction with what we call good sleep hygiene. So good sleep habits.
One other question.
Yeah.
When is the best time of the day to take blood pressure medication like lisinopril? Morning or evening?
Yeah. The common wisdom on that has toggled between morning and evening every so many years for many, many years. So I wouldn't say that whatever the time is that you're most likely to remember it every day is really the most. So I'll say that, and then I'll say this. Your blood pressure is always a little higher in the morning time.
In the morning?
Right after you wake up, just part of the waking up process for your body, your blood pressure is usually a little higher in the morning than it's going to be in the evening. And so for a while, the recommendation was take it in the evening so it's in your bloodstream and going through in the morning when you wake up, and that way it helps keep that a little, knock the top off of that. And then they started saying the morning for various reasons, and it just keeps, everybody's got their own.
Sides of the
Yeah,
scale.
yeah.
Sure.
I would say that part's not as significant as actually remembering to take it every day. So whatever time of day helps improve your ability to take it every day and remember it. That's the most significant. Yes.
When I go to the doctor to get my blood pressure checked, I am so apprehensive because I know that machine is going to hurt me like crazy.
Okay.
And I know that elevates my blood pressure. I can feel it.
Yeah.
I have even if they do it manually,
Yeah.
it still hurts, and I can't believe that I'm getting an accurate read on my blood pressure.
Gotcha.
Does anybody study that? I mean, am I
Yeah.
the only one that hurts?
Yeah, no, that's a real thing. It's called white coat syndrome. That's a very real thing. And if you're in a conversation with your doctor where they're saying, we think we're going to need to prescribe some blood pressure medications because your blood pressure is really high every time you come here. Now, no doctor is going to or shouldn't diagnose you with high blood pressure based off of one independent reading in their office. That's not how that works. They have to have a consecutive series of office readings, and they usually try to recommend that you start taking it at home and keeping like a log, and that way you can. Gotcha.
And
Yeah.
I can't believe that it's an elevated. I just, that
Sure.
makes sense.
Sure.
How about the wrist ones?
Yeah, you can do wrist ones. They're not as accurate. They're not as accurate as the cuff ones are. I will say that. They're definitely not as accurate. But I would say if you might want to make sure you have the proper size cuff and that you're getting it.
When the doctor does it, I
Okay.
have the problems.
Yeah. You take it at home at all?
Yeah, I've done it all.
And it's still.
I just decided I'm just not going to take it.
Gotcha.
I'm just not taking any medicine. I'm not taking it.
Gotcha.
Whatever.
Yeah. So the thing I'll say inside of. Oh, thank you. Yeah, the thing I'll say inside of that that I see a lot of times as a pharmacist is sometimes we don't have a healthy relationship with our primary doctor in regards to being open and transparent with one another. So it's like it's your personal choice to decide whether you're going to take a medication they prescribe, but you've got to make them aware of it. A lot of times what I see people try to do, and I understand it, is you go to your follow-up appointment and the doctor assumes you're taking the medication they prescribed and you decided not to take it for various different reasons, and you don't communicate that, and they see your blood pressure is still high, so they add another blood pressure medication or they increase your dose. And it's like, well, they're assuming that you're taking something that you're not taking, and this is where we end up with what gets referred to as polypharmacy, people taking a bunch of medications they don't even need, or at least being prescribed a bunch of medications they don't really need.
Well, and I saw recently that there's a blood pressure medicine that they've come out now that causes cancer. It's got, and I just don't know what to do.
Gotcha.
You know.
Gotcha. Yeah, I think you may be referring to the recall that happened. It wasn't just blood pressure medications. They were really a big part of that recall. There was just something in the manufacturing process by some of the drug manufacturers where they were getting I'm going to get the acronym wrong. It was like NMDA or something. I don't remember the exact acronym. Yes?
What are the benefits of red wine?
Benefits of red wine. Do you want to drink it or not want to drink it? Yeah, so it was common for a long time to say that you could have one glass of red wine and that there were some health benefits of that. If you look at the totality of study data, the risks outweigh the benefits, and so it's really like a net neutral. Alcohol in general is considered a risk factor, so you can't really, yeah. I would say better off not to drink it, but hey. Something on occasion. Look, the things that are going to impact you the most are the things you're doing every single day, right? So if you have a glass of red wine when you go to a special event or something, and we're talking about, a dozen or so times a year or whatever it is, I don't know. That's a very minuscule part of your overall risk factor. It's more like, are you eating Wendy's and McDonald's a couple of times a week? And are you, not eating any fresh vegetables and eating big chunks of steak and no vegetables? And yeah.
What about the impact of sleep and sleep apnea?
On heart health? I don't have any specific information off the top of my head to share with you on that. I wouldn't be surprised. Certainly stress can be a risk factor, and so lack of sleep or poor sleep due to sleep apnea, I would imagine has an impact, but I don't have any specific information to share. Yes?
Could you comment on the safety profile of Eliquis versus Xarelto in AFib?
Safety profile.
The danger, obviously,
Yeah.
to be concerned is intracranial hemorrhagic stroke.
Yeah. Yeah, well, I'm trying to remember, one of those two has a reversal agent now. Without really looking into the study data specifically, I haven't looked at that in a long time. They're both very commonly used nowadays, and I don't have specific information to give you at this moment about the difference in safety profile. The big thing with those new oral anticoagulants when they started to come out was, because they were quickly replacing warfarin, which was the long-time gold standard in blood thinning, but had a lot of monitoring requirements and dietary fluctuations and how much vitamin K you were consuming was going to impact the levels of your warfarin. So that was very burdensome on the testing, monitoring side. The advantage to it was that there was an easy reversal agent, so if you were to hurt yourself or come into the hospital after a car accident or something like that where you might have a brain bleed, they could quickly reverse the effects of warfarin. They came out with these new ones, Eliquis, the factor 10A inhibitors, Eliquis, Xarelto, and the great thing about those is they didn't require the monitoring. So you could just take a pill or 2 pills a day, and we don't have to worry about checking levels or anything like that, and that was fantastic. The downside to it when they hit the market was that there was no clear way to reverse the effects of the blood thinning. So there was that risk that if something happened where you were bleeding out, we don't have a way to stop it. Not a clear-cut way. There's things they do, fresh frozen plasma and stuff like that to help reduce the bleeding, but they're not reversal agents. I haven't looked into that in a while, and I need to freshen up on that because I believe one of those products does have a true reversal agent. I don't know how commonly found it is, though. I don't know if it's widely available. That's something, I work in the community. That's something that would be more on the top of the mind of somebody that's working in the hospital because that's where they're going to use something like that. But yeah. So that would maybe be something I would think you would take into account as far as the safety profile goes. Does it have a true reversal agent that we can use in an emergency situation? Yeah. Any other questions? We're good? All right. You guys were able to get copies of the presentation? Okay. All right. Awesome, guys. Thank you. Mhm.